empowering schools and parents, a holistic approach to eating disorder treatment. So just before we start, I'll say one of the missions that we have at Health Deliver is really to support school, student, and parent partnerships with unique expertise, which can be quite difficult to find in Thailand. And today, the reason we are here today is because schools have actually told us, look, this is an issue that we're really struggling with. So really for us and working with international schools, we're really here to make sure that students can keep learning, can stay in school and reach their academic goals. That for us means a job well done. And I think very much the same, that's the same for you as well. So our missions are definitely aligned. So I'm just going to first pass over to our experts here to introduce themselves, who they are, where they're from, and a little bit about the work that they do. So maybe ladies first, I can start with Dr. J.
Hi, I'm Dr. Jane Siriganson, and I'm a clinical psychologist. I specialize in neuropsychology. I had all my higher education all in the United States. So graduated from NIST here, high school, went to University of Oregon for my undergrad. Then I did my graduate school at Pepperdine University and American School of Professional Psychology. I got my license there in Northern Virginia, practiced there for about 5 years, decided to move back here last year. And now I'm here with Health Deliver. I do assessment to diagnose, give diagnosis and treatment recommendation. I also do consultation or psychotherapy for any individuals with any psychological issues or development in terms of learning issues, working with parents to help them kind of find strategies to help manage, or children with attention deficits and things like that. So pretty much across the board of psychological issues.
Okay, thank you, Dr.
That's a long introduction. Okay, nice to meet you all. I'm Dr. Shop. You can call me Dr. Art. I'm specialized in preventive medicine. I trained in Mahidol University, in Bangkok, and my focus mainly as preventive medicine. I think is a very general term, so it's quite difficult to say what is my specialty, because it can be basically everything, right? As a preventative approach, how my day-to-day job is about take care of patients with chronic symptoms. Actually, it's not just a part of eating problem, but it's about anything. Okay, for example, patient may come with sleep issue, weight gain, hormonal problem, or even mental issue. It's a wide range of the treatment. But my main focus is on metabolic health. So most of the time I'm dealing with the patient that's on the overweight side. But of course, sometimes it can be overlapping between overweight and underweight. And another part that I'm really focusing on is nutrition. Like the topic that we are discuss today is about eating disorder, right? But the main thing that can be underlying issue is nutritional issue. So that's what I'm doing. So it's I'm doing everything to holistically, I would say holistically.
Great. Okay, thanks. Okay, so maybe just we'll frame the topic today. And last month in the UK, there was a report in the Lancet Medical Journal with kind of some staggering statistics. The first is that child mental health admissions to acute wards in England has risen by 65% in 1 decade. And in the same report, it said the number of admissions for eating disorders in children has quadrupled in the same time. So you can see that this is probably of a growing concern for both schools and parents alike. So Dr. J, I think I'll put to you first. What is an eating disorder? What are the different types of eating disorders out there?
So there are actually like many types of eating disorder, but most that the ones that we usually see in children or more common these days are anorexia, bulimia, binge eating, overeating, night eating, and etc. I mean, you know, these are all categorized under like eating disorder. They have slightly like different or well some slight and significant different of presentation symptoms, but they all lead to significant impact of their health, mental health, or daily functioning.
And Dr. Art, what kind of signs and symptoms are we seeing of eating disorder?
So regarding Dr. J mentioned about different types of eating disorder, so the symptom can be different. Okay, and of course, when it's come to eating disorder, there's a wide range. There's spectrum of eating disorder. Okay, I think everyone may have more or less eating disorder. Okay, at some period of time, right? Sometimes we gain weight, sometimes we lose weight, sometimes we want to like avoid particular foods. Okay, sometimes we cannot control ourselves, right? I think everyone, anyone having that problem, right? We know what to eat. Okay. Every time, not every time. Many times when I ask my patient about the diet, they know. Okay, the knowledge is not about the knowledge. They know what to eat. They know what's healthy, what's unhealthy. But when it's come to disorder, it's like there are some distortion of thoughts. Okay, it doesn't mean they don't know this not good, but there are some distortion about their belief. So the sign and symptom that patient might manifest is like if we compare with normal people, we see some not very big difference, but it's a subtle changes in terms of diet and dietary habits. For example, like we may at the earliest point we may see children try to like choose the food that look healthy, okay, but maybe too healthy. Okay. So it's like offset with healthy food, offset with lower fat, okay, consumption on lower calorie. It's not good, right? It's not good in general, but if it's like obsession to this, it will lead to symptoms. For example, like some that may have a like red flag style disorder is like they may eat too little, okay, avoid high calorie diet, and of course for physical side we see that they start to have changes in their body weight. Okay, sometimes it's like very quick changes. Okay, that's the early sign that the problem. And there are many other things like when they have the activity that's involved with food. Okay, they may try to avoid. And some physical symptom. For me as a doctor, I think the thing that alarming us is physical symptom. If they have symptoms like dizziness, fainting, or developing low blood pressure or hypertension, that's the sign that's too much for them. Okay. But for me, it's because it's a spectrum. If they like focus on the healthy diet, I think that's totally fine. We have to make sure it's not on this one. Okay, so it's like nutritional deficiency, hormonal imbalances. When I say hormonal imbalances for women specifically, they may develop some kind of like hormonal problem, like not regular menstruation. I think we have seen a lot.
Yes.
Okay.
Yeah.
Not just for adolescent, but also for adult. And another very important thing I think is it's not alarming. It's not a red flag, but it's a sign that they may develop eating disorder in the future. It's like they just obsessed for exercise. Okay, and then not because they want to get healthy, but because they're afraid of gaining weight. Okay, that's the sign of eating disorder. Okay, but when it comes to another side of eating is like binge eating, right? That is like compulsive eating. Okay, this is the sign of stress. Actually, I think it's quite difficult to like pinpoint that they already have binge eating because sometimes it's stress related or sometimes it depends on their circumstances. So we have to look closely about these issues. Sometimes because they're stressed, they not get enough sleep, so they develop too like They eat because they need more calories. Okay. But for binge eating, it's like the person who eat cannot control eating habit and then gain weight and then they feel guilt or feel shame, but they can't stop themselves. You know, like when it comes to like normal people, we eat a lot, we gain weight, but we still feel happy. Okay. Yeah. Okay. We say okay. Next time we want eat that much. Okay, but we still happy. But for children who are having binge disorder, the difference is they feel guilt. Okay, they don't like the way they do. They know it's not good for their health, but they cannot control themselves.
Thanks, Dr. Ard. I mean, actually, so you bring us on to the other point here, which is really what causes what is the root cause of the eating disorder, or is it a problem in itself, or is it a symptom of another problem, Dr. J?
Well, for this one, I have to say, like Dr. Art also has touched on some of the issues or causes already. Like, it's very hard to say like what causes it. It's unclear. A lot of time we'll see that mental health conditions are what lead or develop or cause someone to develop eating disorder. And like I said, what was mentioned earlier, it could be like stress, distorted in like the thought of like the body, how one should look like, depression, anxiety, impulsiveness. It could be like genetic environment, could be trauma, for example, like sexual abuse. Those who actually went through it tend to develop like just the feeling of having to be in control in certain ways, or just to fulfill, like they just develop like a bad relationship or unhealthy relationship with food. And so they look at food in a different ways or use food to comfort them, lack of control or want to be in control of something. So all of this, it's like when you're out of that balance, it can cause issues one way or another, either restricting too much or eating too much. And not to mention, or let's mention, like eating too much and feel guilty and bad, then you purge, right? Like you vomit, you exercise too much. So anything that's over the limit, it's problematic, or it can lead to something more severe.
There's a book that came out recently in the US, written by an American psychologist, called The Anxious Generation. And he says that the introduction of smartphones in the early 2010s was the largest uncontrolled experiment humanity has ever performed on its own children. So really, it's the fact that children have been affected. I mean, what role do you think that smartphones or social media might be playing in some of this?
I think
Dr. J,
yeah, huge here. And even like these days, the current issues or topic of discussion is that in school, should kids have like cell phone, or at what age? And I think like in other countries, they actually started to let kids take the phone away during like classes, or children are not allowed to have cell phone until I believe like over 10 or something. Like I'm not sure, and I'm sorry, I don't know like the exact number, but yes, it has become like an issue here. But social media, of course, like for me, and not even like for children, right? Like for adults as well, it's so easy to access. We look at news, we look at pictures and what the society says about like what the standard should be like, and it's pretty scary. Sometimes it's so distorted. And I mean, I'm probably like one of those who look at and kind of have that thought too of like, oh, this is considered like beautiful, pretty, right? But it's not necessarily like healthy. And so I think like, for kids and being in school where there's peer pressure or bullying or something, right? Like in some places. And so I think all of this kind of play a huge role. And maybe Dr. Art has some thoughts on this too.
Yeah, but right, the thing that Dr. J mentioned, I think it's very general, right? Every generation facing the same thing. Of course, cell phone, social media, maybe like the trigger that make it farther. Okay, this will maybe quicker and like more exposure to this kind of thing. But actually, everyone exposing to that. For me, I think the major causes of the problem is because children is still very susceptible, very vulnerable to this kind of thing. It's difficult to say at what age is safe to use cell phone or social media. But for me, I think the way that we can do is we cannot avoid, right? This thing we cannot avoid. Some school may have an access to do like avoidance cell phone, but most of school cannot do that, right? Even you can do that, but when you go back home, they do the same, right? So it's not gonna fix the problem. But the way that I think is key is, right, we have to screen for the one who's sensitive to this thing. Okay, because from the research it showed that the one who are develop eating disorder, 40-50% is genetic. Okay, so it's carried from genetic, like from psychiatric disorder or something like that. So not everyone have the same impact from cell phone. So for me, I'm the right side of using social media. If you use it right, we know, right, that social media is not 100% true. Okay, but only some people that's very vulnerable to this thing need to be very. We have to be very careful, and we have to look for them closely. Okay, so if they have the sign of disorder, of eating disorder, we have to track and address the problem first. So for me, I think it's totally fine to have this kind of thing, but we have to get the early treatment. And we have the data from the treatment that when we know they have the problem, of course it's not an easy treatment for eating disorder, but everyone can get recover. Okay, so it's treatable condition.
And Dr. Art, with your younger patients, what are really the most serious impact on their lives of having an eating disorder?
First, medically, I think it's about nutrition. It's about their growth. Okay, so if they're not getting enough calories, not getting enough nutrients, they're not gonna go normally. Okay, physically and mentally. Okay, we need to make sure we get all the organ, all the system developed. Okay, so in my experience, I've seen some of the patients. They have to right, children need to work really hard. Okay, they have to go for exam, they have to go for their activity, so they need a lot of calories. Okay, it's not the time that they focus on healthy diet. Actually, it's the time that they focus on generally healthy but not too healthy. So for me, I think the major the most problematic thing is they develop nutritional deficiency. Okay, and then when they're imbalance in the body, it's like a vicious cycle that make recovery much slower. For example, when we think about this kind of thing, it's like mental problem, right? We need a consultation with Dr. J, right, for like what is a good relationship with food. But eventually, they're not gonna get much improved if their brain not really optimized. So it's about nutrition. So first thing first, I think it's about nutrition.
Okay, and tell us a bit about the different approaches or pathways to treatment.
Conventionally, I think the main thing is we have to look at the fundamental, nutritional, hormonal. Okay, this is the main thing that we usually do. When we look at this kind of problem, we have to make sure they're not having a serious condition. For example, like mineral deficiency, hypotension, or hormonal changes like menstruation period problem, something like that. But look holistically, I think there is many things involved. Have you ever heard about gut-brain axis? Okay, this one very important. When they develop mental problem, every time for me, I'll focus on gut health too. Okay, we don't know which one comes first, mental problem or gut health comes first. But either mental health start first, gut will get trouble. Okay, so we have to focus on nutrition, digestion, and uh, and make sure we understand the connection between gut and brain. Okay, we have the term called gut-brain axis. It's very important. So for me, I think, of course, the main treatment still a consultation, because we have to fit their beliefs, okay? But we have to make sure they have the right condition to get fit.
Okay.
So for me, I'll focus on gut health, metabolic health, and mental health.
And some families may present to a psychologist first. What kind of screening, what would this initial screening look like for a patient with an eating disorder?
Yes. So if they come to me first, then of course then I'll do like thorough intake for history, like family history, just any medical or psychological history to like eating habits and what they eat and just like how they do on a regular day. Now again, like I really appreciate what Dr. Art said, because to me, like eating disorder is very complicated, and of course the word holistic is the key here, that I do believe, like the mind body connection and how to treat one and make it most effective, right? So the psychological piece, yes, like I said earlier, that a lot of mental conditions can develop or lead one to develop eating disorders, and that is the piece that I do screen for. So look for like any signs, symptoms of depression, anxiety, impulsivity, obsessive compulsive, with a thought, right? Again, like what Dr. Art said earlier too, that people know what they should or should not eat. They know when to stop eating, but they just can't control it. Or sometimes they don't want to eat or restrict their intake so much because they're so obsessed with like, the thought of no, I shouldn't, or with the body. So they're all of that, but so that is the piece that I will look into as well. And of course, like the physical side of it that I can't get into, right? Like for me, it's through screening, questionnaires, asking questions. And then, yeah, the physical piece is where Dr. Art would kind of get into and really look at the physical change in it. Yeah. So like the mind, thoughts, psychological here, and then the physical, it will be like other type of testing to get into physical internally.
Okay. And then looking at ongoing treatment, so maybe between both of you, what might ongoing treatment look like for an eating disorder?
For me, initially we have to make sure they're not in critical problem. Okay, so we screen for their overall health, okay, like metabolic health, nutritional things, and most patients can be okay with like outpatient, okay, doing outpatient treatment. But for seriously ill patient, they may need to get admission, okay, because they may already develop very severe nutritional deficiency. Okay, not a lot. Okay, only minority have that problem, but most of them they tend to be like okay with like the OPD case, like outpatient case, but the effective treatment need to be. I think we need multidisciplinary team to help with that, but it doesn't mean we have to start with a big team. We start first with maybe one doctor or one psychologist. It should be fine, totally fine. Or even a teacher or a nurse that's taking care of them. The key thing is we have to build trust. Okay? We have to make sure they trust us. We have to make sure that when they have the problem, they can tell us. Okay? So the problem that we usually see, not from practitioner, but many times from family. They judge the patient, right? When they judge them, of course, like children tend to, even normal children tend to resist our advice. So that's normal for them. And if, with this kind of disorder, they have more resistance to it. So we have to start gathering and build trust, okay? And make sure they understand their problem, okay? Because insight very important. I have one example is my patient. They develop very low body weight, like very low BMI. They but the problem is that they don't understand that is problem. They believe is a healthiest way that they can do, okay, for for her health, okay. So she believed that healthy diet, even with her age like 13 years old, is okay. Okay, this one, I as a doctor, I cannot tell her that it's wrong. Okay, you're underweight and you need to gain weight. It's not like that. So we have to have someone that can talk and discuss about food, discuss about overall health and what to do, what to improve, what to what to change to get improvement in terms of health. So it's not the treatment itself. I think actually it's like counseling. Okay, family can get involved, medical practitioners, psychologists can get involved, and even friends and their peers. I think everyone can get involved with that. The big problem is not everyone understands this issue. Right? They think, okay, why not eating this? Why not eating that? Something like that. Okay, especially parents. Right?
Yeah.
So this one we have to start first with that. Okay, because the treatment itself is not a medication. It's not actually the we have one pill for one condition and then the problem go away. It's not like that. It's more of like long. It's long ongoing process. But eventually, 1 year, 2 years, 3 years, they can improve. Okay, that's the main thing.
I kind of want to add a little bit to what Dr. Art said. It's very important, especially with like that trust and build that relationship initially, because yes, it's very, those who are dealing with eating disorder, a lot of them will say like, I don't even want to talk about it. Like to most people, it might just be like, oh, like eating disorder. Some people before even thought like it might be like a cool thing to have it, but it's really not. It's a struggle that one has to carry and deal with. And parents, let's say using example of restricting food, right? Like sometimes parents don't understand that it has more layers to just not wanting to maybe gain weight, let's say. And parents might say like, you should just eat it. Like, oh, why? Are you afraid that you're gonna you're gonna gain weight or something? So sometimes, and a lot of times, it's not just about the weight gain and so many things emotionally that involved. And so I think, yes, understanding, not judging, allowing the person to actually like share what's going on to help them, establish a new way of looking at eating or food in general. Yeah.
And Dr. J, a therapeutic course with you, what would that look like, and how frequently would you meet with the patient?
So for the psychological part, like the services, it takes time for the treatment. And I think like, once a week in one-on-one, or maybe like other sessions with like parents involved, from research too, it says like it can take like a few months all the way to years, right? It's pretty much like based on each case. And like I said, this is only just for the psychology part, not to include like, the physical, like with the nutrition, change of diet. Because for my part, it would be like try to change the way you look at it, change the thought process, and change the habit and behavior. Yeah.
And just a question on medication. Is medication usually required in these kinds of cases? Maybe for both of you.
It depends. In cases involved with like psychiatric disorder problem, maybe medication can be a good can be helpful. Okay. But many times for eating disorder, medication is not a solution. For example, like anorexia or bulimia, these kind of thing, we prove that medication doesn't work at all. So we have to focus on counseling. And we may have some special treatment like CBT, cognitive behavioral therapy. Actually, it's counseling. Okay, it's not anything fancy. It's counseling. But for medication, for example, the one who already developed depression, anxiety, or sleep issue, I think medication could help. because it's not about treating just the root cause. It's about fixing all the problem and rebalance the system.
And just on what we've spoken about today, it involves obviously patients, students, parents, experts, involves the school, the family. Going to a hospital in Thailand can be maybe a not particularly friendly place to deal with an issue like this. Everybody has their departments, and rarely do the departments kind of cross over or talk to one another. What do you have in mind in terms of what you guys can do here at Help Deliver when working with patients, and what do you think are the benefits compared to this kind of hospital system?
One thing is that like we have providers who are specialized in different areas, right? And like mentioned earlier, that eating disorder, it takes like the whole team, kind of like, multidisciplinary, like what Dr. Art said. And in a setting like this, where we tailored the treatment based on what the client, the patient needs. It's not like, okay, this is the pattern, and then we're just gonna use the same treatment for everyone, but we kind of tailored and try to understand like what that person needs. Now, whether the case, the client, the patient goes see, let's say for example, Dr. Art first to check the physical, or whether it comes to me first, if we detect, or usually especially with eating disorder, then we will, of course, like consult and refer to have this case like get tested, evaluated, like comprehensively, like try to, and just with the setting like this, I mean, I'm sure just one call away to Dr. Art and he'll be like, oh, okay, like, we'll discuss this or something like that. So, that less of the time to consult with each other, or eventually, or even like if we have to sit together and do the case consultation together, it will also be possible as well, like with the telemed and all of that. It's pretty convenient to kind of sit with patient, parents, the whole team to really discuss and find the best solution or best treatment goal. Would you say the same thing?
Okay, yeah, I'll believe in the team. Okay, we need to have team, especially for mental problem. Okay, one-on-one doctor consultation doesn't work at all. Okay, and I'm not believing myself too. Okay, but I can take care of the patient with this condition, because if they don't touch me, that's all. That's not nothing else. I cannot do anything. So we need to have a good support team to help with this. But I think the gap, if you want me to compare between treatment in the hospital and in the clinics, is normally conventionally when we treat this problem, we focus on dietary habits and psychological part. That was only main of their focus. But I'm trying to I try to think more holistically. So of course, it's not just nutrition. It can be something else like hormonal problem, gut health, neurotransmitters, or even genetics and toxins. Okay? So we have to figure out what cause imbalances in the first place. Okay. Of course, we know that this kind of disorder usually triggered by something, but they are vulnerable patients. So they have to have some, how to say, like weak link in their body. It can be gut health, it can be neurotransmitter, can be nutritional things, or can be their genetics. So this is the missing piece that I'll try to fill the gap.
Yeah.
Okay. So I don't just check for nutrient. I'll check everything possible. Okay. I mentioned toxin, right? You know that. Not just social media that trigger the problem, but in our environment at the moment, a lot of toxin, a lot of pollutions. So we cannot deny that maybe this toxic problem or toxic burden can be one of the cause of the problems.
And just a last question: are there any specific age groups that you're looking at? I mean, how young? I mean, would you see patients and I mean, we're talking up to age 18, I guess, at schools, but I mean, how young would you accept a patient or see a patient?
Not too young, not too young.
Yeah.
Because their physiology not very similar. Okay? So let's say when they over 10, that should be acceptable. Okay, because they are light adult. Okay, in terms physically. So, but for very young children, okay, of course, when it's come to like this kind of problem, eating disorder, it's not very common. It's common in adolescent.
Yeah.
Okay, so we can literally say they are adult already. So for me, for this kind of patient, I'll accept almost every patient, unless they have very clinically ill problem or comorbidities like sugar problem or hormonal very serious hormonal problem. That I need to refer to a specialist.
Okay. I did actually want to put one question out here to the audience, because you will see patients that call us, knock on your door, but before a patient has got to that point, there's been usually a very difficult conversation between a school nurse or a counselor or a parent beforehand. And I'd just like to put it to the floor to, if there's any advice here you would give each other on having a conversation with a student about this, and how that conversation might go. So if there's anyone out there who'd like to offer some advice, I think it would be useful.
Do you mean to say how we would kind of discuss with the child to seek outside support? Is that what you're referring to?
Yeah, right. Or even maybe the very first conversation that someone might have with a child if they notice a sign or a symptom, or yeah.
Okay, I think I would say the first thing is definitely no judgment and kind of open-ended questions, allowing them to feel that whatever it is that they're going through, experiencing, isn't necessarily something that needs to be judged. I think that's the most important thing. And showing that you want to try and understand them and what they're experiencing, I think that's a really good way to start, particularly like with eating disorder clients. If you're focusing immediately on why they're not eating, focusing immediately on their nutritional deficiencies, that's going to create the distrust, I think. And it's about understanding what is it that they're experiencing at the moment.
Yeah.
And that helps with the conversation in getting them to get the support that they need.
And would that typically happen with a parent as well in a school setting?
For a parent to seek support for their child?
Yeah, or a conversation to happen with the child at the same time, or would it just be with the child, or would the parent be involved later?
I guess in my context it's quite different, because I would have the conversation with the child first and see what feels safe, because I don't necessarily know what the situation is for them.
Yeah.
I think having it with the child first and then bringing in the parent will be
Excellent. Okay.
so that everyone is on the same page, because at the end of the day you need to ensure that everyone has the same perspective.
Yeah. Great.
Yeah.
Okay.
And also for nurse pass volunteers, because for the nurse we have the first aid room, right? And so if there's some student they show with the gut problems, we ask them, have you eaten? There's the easy, like simple question, have you eaten? But sometimes the students respond, oh nurse, no, I cannot eat. And so that's why, okay, you need to consult with the counselor. Sometimes we monitoring. If 1 week or 1 month we found the student has like repeated problems, they have the same problems, we will like ask their parents about this, what happened, and then if they need like a specialist, we like transfer the case, refer the case to counselor.
Yeah. That's true. How long have you been working as the nurse?
More than 15 years for the nurse, but for school nurse 10 years.
10 years, okay.
Yeah.
So have you seen this issue trend? Yeah.
The issue trend is like increase.
Okay.
Yes.
Okay.
And also, because every year, because from in the past, I think the student don't want to share and they be shy to share the issue. And also for how we call this or disciplinary team, in the past maybe it's like I'll have a field group, but so right now we are for the school we have strong relationship with
Right.
collaborate together, counselor, nurse, teacher, head of year, and also well-being team. That means we known about case is increase in number because we close together and so we close monitoring. That's why we know about all the student face with these problems. And also for the school, we did not record about their height or their weight because this is a vulnerable information too because some Thai school they record for weight and height, but for school our school not.
Right.
But if something have alarm, counselor will invite us to have to consult, and they will share some information, and we have the way to support the student.
Excellent. Thank you for giving us the insight on how it works. And I know Bangkok Patna is one of those schools that has a lot of resources. So it's great to see what the other side of the coin looks like. So thank you for sharing that. Okay, so I think we can take some. If there are any specific questions that you have.
I had just one question. I think this would be for you, Doctor. In terms of a client who might be in a really critical condition, severe nutritional deficiencies, and they have to be admitted into the hospital, what is the take like here in Thailand in terms of force feeding when it comes to patients with eating disorders?
In this kind of situation, we don't have to worry that much because they will already develop some symptoms and they need prompt treatment. Okay, for example, for the treatment that we usually do is like the infusion of calories like nutrients. That's kind of how to say like protein, amino acids, carbohydrate, sugar, and fat. Okay, that very important. And but it's kind of like very urgent cases, so you don't have to worry that much. And then after that session of admission, there even the patient themselves they already know that they have problem, and then it would be easier for long-term treatment. Okay, so it's but I don't think we have a lot of that problem. Okay, like, because you have the system that you screen the risk first, right? So nowadays I don't see a lot of seriously ill patient. But in that case, just consult a hospital that you are with, and then maybe short-term admission or long-term admission. This answer the question. Have you experienced this kind of cases before?
I have had a very serious critical condition student before in the past, but it was the experience in the hospital that was quite traumatizing in terms of their recovery process after. So I just wanted to know.
Yeah, I think that just depends on settings. Okay, if the setting in the hospital that taking care of eating disorder, they will know what to do next. Okay, to of course when finished the inpatient treatment, they will move to outpatient treatment, and they will have a team. Okay, I think it's about that team. So in this case, you facing the problem with that, maybe you have to check with them. Okay, what the process that they want to do in the future.
Okay, so we'd like to ask Dr. Jane one question about we work in the school, right? And so how long we should to ask the student or parent to send to the doctor because alarm about eating disorder. Because some students they have the medication to treat with their conditions, and they face with the experience with side effect of medicine, but the nurse did not cut point. I don't know about cut point. What this is just the short term of side effect of medication, or that turn to the eating disorder. What the things can that cut point.
That's a really good question, especially when it comes to like the side effect of medications, right? And you don't know like how long. And my question back to you is that do you have like, I mean, is this something that you check in with the parents as well, whether they check with the prescriber, like the one that person, so that's checked regularly.
Yeah, because the doctor, the parent shared information what the medicine with the child they treat it.
Yeah.
But we have some clues from the student, but not whole story. Yes, that's the way we have the limited of the how we make decision. That is the alarm from the eating disorder or the side effect.
Yeah, and the reason I asked about that is because when someone is on medication, and because I don't prescribe, right? Like when someone is on medication and if they're dealing with some side effects, my suggestion or recommendation would be like, well, the parents have to be informed if you start to see like, this is kind of like an ongoing for a while, and they actually have to consult with the doctor who prescribed the medication first and see like can something be adjusted now for consultation and see like could this be like something in additional to just the side effect or anything else. I mean, of course, like the sooner the better. Let's say like the psychological piece, I would say like it's hard to say like how soon, right? But to me it also, in general, it doesn't hurt to kind of like get checked and consult just to see like if anything is going on. Yeah.
Okay. So I think you can maybe have a cup of tea or a coffee, or if there's something you'd like to, a question or two you'd like to direct to Dr. Art or Dr. J, I think we can do that after. But I think that's it from us. Just to thank you very much for coming today. Thank you for the questions. And we aim to do these types of speaking events kind of every couple of months. So we had ADHD as a topic before, and today it's eating disorders. If there's anything out there that is challenging you guys in your working days and or a topic you'd like us to explore, please do let us know, and we'd be happy to get into it. So thank you again for coming, and thank you, Dr. J.